Hello everyone. Today we'll be talking about injections. Now, injections are a parenteral way of giving medications. There are four main types of injections: intradermal, subcutaneous, intramuscular, and intravenous. There are intrathecal injections and intra-articular injections, but they are more advanced. Mm, Injections, we need preparation of injections. We need to ask consent of the patient. Then we need to prepare necessary materials. This may be the syringe with needle, the medication for injection, sterile cotton, sterile gloves, and apron for the staff to wear. And if you are giving IV, we may need a tourniquet. So delivery of intradermal injection. Intradermal injection is the site of insertion of intradermal injection is medial aspect of the forearm. The site of insertion must be cleaned properly using cotton dipped in antiseptic solution, like so. After cleaning the site of injection, we allow time for the alcohol to evaporate. Once the alcohol evaporates, the site of injection is held by placing the hand of the applicator around the forearm like this, and then we push the skin upwards. The needle is chosen such that it's a 25 to 27 gauge needle, around 1 to 2 centimeter in length. It usually has a pink tip. Now, advancing the needle, you should keep the bevel upwards, and the needle is inserted at 15-degree angle to the skin, like so. After advancing few millimeters, we can advance the medication slowly, such that a wheel is created at the site of injection. Once the wheel is created, we can withdraw the needle. We will not apply cotton in this point. Such injections are done for long-term release of substances. For example, rabies immunoglobulin, or for example, in Mantox test to see allergy of the patient. Subcutaneous injection. Subcutaneous injection, the site of insertions are the deltoid region, area around the umbilicus, and medial aspect of the thigh. Once to hold the skin in deltoid region, it's held such that there will be an apex and a base, so it's basically a triangle. Will be infiltrating through the base of the triangle. If it's around the umbilicus, a skin fold is taken. It's the same with medial aspect of the thigh. For injection purpose, we'll take a 25-27 gauge needle, around 5 to 8 inches long. So if this is the deltoid region, the triangle is made, will be infiltrating through the base. The needle is held such that the index finger is at the below the flash chamber like this, and the rest of the finger will be supporting the needle. It's advanced at 45-degree angle to the skin, like so. Once it's inside, this hand will fix the syringe. You can release this hand and advance the solution. Once the solution is inside, we can use you can put cotton on top and then withdraw the needle. Subcutaneous injections are given, for example, during insulin. We must keep in mind that we must circulate the insulin injection site such that there won't be atrophy of the subcutaneous tissue. Intramuscular injections. Best site for intramuscular injection is lateral upper quadrant of gluteus area. This is to prevent damage to especially structures such as sciatic nerve. So the site, the needle size is around 2/3 of 5 to 8 of an inch. Usually they are black tipped like this. The position of the patient must be prone position. This is to prevent constriction of the gluteus muscle. uh, in that case the needle might break if there is excessive force around the muscle. The needle is advanced at a 90-degree angle. It's held in such way. The little finger supports the flash chamber, while the index finger is on the plunger, and the three fingers support the body. We may even get a gluteal fold, or we may try to create a Z-track by pulling downwards. So if we create a Z-track by pulling downwards, it would be like so. And then remember that the injection site has been already cleaned. The needle is advanced at 90-degree. It's advanced as fast as possible to avoid pain. As you can see, I have left 1/3 of the needle outside. Once it's inside the muscle, we may pull back on the plunger to see if it has hit any capillary or vein. If blood is negative, we may advance the solution. After the solution has been advanced, we may now place a cotton and withdraw the needle. Intramuscular injections are given for quick absorption of delivery material. Intravenous solution. Intravenous injections. Intravenous injections are better than other three because we can determine the exact concentration of medication in the blood. Before we begin the process, we must apply tourniquet to find the position of the vein. So this is a simple way of applying tourniquet where we don't have commercial tourniquets. We can use a wire like this, a tube like this, take a cross where the little hand goes above the big loop, big hand. Once it's like this, we may create a loop by pushing it inwards and tighten it like so. At this point, we ask the patient to clench, to pump his fist. That way we can see the dilation of the vein, the cubital vein. So once we should palpate and then find the position, and then we must clean the area of injection. After clearing the site of injection, we ask the patient to clench his fist, and then we fixate the vein to prevent it moving during injection. I'm showing at this angle for you to see better. Once it's fixating the vein, we advance at 45 degrees inwards until we see blood in the flash chamber. Once we see blood in the flash chamber, we make it at an angle of 15 degrees and go parallel to the vein. Once we fixate at this position, we can pull back on the plunger to see if it has hit the vein. If it's so, we can see blood in the aspiration. If it's positive, now we may release the tourniquet by gently tugging on the tourniquet. It's easily released, and we ask the patient to unclench his fist. And now we advance the medication. Once the medication has been advanced, we apply cotton at the site of injection, and then we withdraw the needle. And that will be all. Thank you.